We have made videos of different anxiety techniques for people with learning disabilities, which you or the person you care for might have already watched. If you haven't, you can find the links to these videos in the playlist. I'm now going to talk through some general advice so that you can support the person that you care for to try them out. Different techniques will suit different people, so try out a few and find the ones that work best for the person that you care for. Before you try out the techniques, it might be helpful to watch the Anxiety in Your Body video so that the person you care for can learn about what anxiety is and how they can notice it in their own bodies. You can talk to them about this so that you are also aware of the signs to look out for. For example, they might notice feeling hot and dizzy when they feel anxious, while somebody else might notice feeling sick or stomach aches. It is useful for both you and the person you care for to be aware of the specific signs of anxiety for them. You and the person you care for can experiment to try and find the best ways to practice the anxiety techniques that suit them and help them to focus. Some people might find it helpful for you to do the techniques with them, while other people might prefer to be left alone. You might do some where you read out the instructions for the exercise, or the person you care for might prefer to watch the video or read a script themselves. Some people might like visual prompts, like a picture of a candle or a timer so that they know how long the exercise might be for. Praise after completing an exercise might also be helpful for some people, and others might prefer that you talk through with them how they feel, both before and after trying the techniques. There is no right or wrong to any of these, so just try to find things that will be the most helpful for the person you care for. Anxiety often leaves us feeling like we don't have any control, and lots of us are feeling especially powerless when it comes to coronavirus. So giving the person you care for some control over how they experiment with the techniques can be a way to help them feel safe and more in control in these uncertain times. Finally, try to encourage the person that you care for to practice these techniques regularly. They might feel a bit unusual at first, but the more that you can support the person to practice them, the more natural and helpful they should feel. It can be really hard to remember these techniques when our anxiety levels are high, because the more complicated thinking and memory processes in our brains are harder to access at these times. So, supporting the person that you care for to practice the techniques when they feel calm might help them to feel more confident and make it easier to use these techniques when you both notice their anxiety levels rising. I hope that you enjoy trying out the techniques and that you find them useful. To find out more about the specific anxiety management techniques that we've recommended for people with learning disabilities and why these ones might be helpful, watch the video called Supporting the Person That You Care For, Breathing, Mindfulness and Relaxation Techniques.